Welcome back. Now, a new study has found that women who have caesarean sections at birth, at an advanced stage of labour, are 8 times more likely to experience internal scarring, which is known to increase the likelihood of premature births in future
Really
pregnancies.
interesting story, this. Well, joining us here is Professor Anna David, Professor in Obstetrics and Maternal Fetal Medicines and Director of the Elizabeth Garrett Anderson Institute for Women's Health at University College London. Thanks so much for joining us. So for those at home who are not doctors, tell us why the timing of a caesarean could then impact future pregnancies.
So the issue, we think, is how low the scar is on the womb and how close it is to the neck of the womb. So that's the cervix. So when you have a labour, what happens is the baby's head goes down through the pelvis, and when the labour is really far on, so when the cervix is almost completely opened up, 8, 9 or even 10 centimetres, and you're ready to push the baby out, the head is really low. So when I'm an obstetrician, when I do the caesarean section, if the head is really low, then the scar could be quite low. And what we found previously is that if the scar is low near the cervix, there's an increased risk of preterm birth in the next pregnancy, probably because the scar actually compromises the function of the cervix, which is to keep the baby inside the womb until you go into labour.
It's so interesting that we haven't really explored this type of research before. Why have you looked at it now, Professor?
Well, we looked at it because we wanted to find out actually what are other risk factors that might affect, how can we counsel people about what their risk is. And so we looked at various risk factors, and we took women who'd had a caesarean section at various stages of labour, between 4 to 7 centimetres and 8 to 10 centimetres. And then we followed them up with their consent. We did a scan after they had the baby, about 4 to 12 months after they had the baby. And we looked at where the scar was, whether they had a scar, how big it was, and then how low it was as well, and how it was healing. And what we found was there's a big difference. If you have your caesarean section much later in labour, you're more likely to have a low scar. It doesn't heal quite as well. But there are also other factors. So if you're a little bit older, if you're further on in pregnancy, and also how we stitch up the cervix as well, the scar is really, really important. So I think there's lots more to do here, and it's quite surprising that we haven't really looked at it very well beforehand.
Yeah, completely. I know for lots of mums, obviously you can elect to have a caesarean with other impacts that will play into that. But if there's a situation where you do have to have an emergency caesarean, I mean, a lot of mums are going to be a bit worried about that. What's your advice this morning on that?
So I think it's really important to realise that caesarean sections are very safe. And if you have to have a caesarean section, they're absolutely critical. They save your baby's life, they save your life. So I don't want people to get worried about this. But I think it's important that people realise that there are potential consequences. So we know that if you have a big scar, you're more likely to have perhaps bleeding in between your pregnancies, chronic pelvic pain, you may be more likely to have fertility problems. So we need to know much more about what's actually going on with the caesarean sections.
If I may, Professor, thank you very much for coming in and for the research. Do we need to think in this country more about our decisions when offering a caesarean section? I know that in other countries, when people have their birth plan, caesarean section can actually be something that is just done as a matter of course, because the idea is to get mum and baby out of the hospital as safely as possible, regardless.
Yeah. So the research we were doing is really about having a caesarean section in labour. And, you know, we're increasingly seeing women who need a planned caesarean section before they go into labour because they have problems with their baby or they're unwell. And that's different. We haven't looked at those caesarean section scars, and we probably should do so. But it's not likely to be that the scar is going to be lower. It'll probably be higher up in the womb. But I think we need to do more, get more knowledge about how we can improve the healing. Is there problems with anemia after the baby's born? You know, we need to help mums recover better. And we also need to get more training in how to evaluate the caesarean section scar. We've been working with Tommy's charity to do that. They've funded us. And also NHS England is also funding us to roll out training to healthcare practitioners about how to scan the cervix. So I think this is a good news story in that we found out more about why it is that maybe women go into labour early after they have a caesarean section in labour.
Really interesting. And all the more information is all the better to make us better. Professor, thank you so much this morning for coming.
Thank you for inviting me.
All the best in your research. Thank you.